morning, everyone. Today's April 7th, and we're about 60 hours from the execution of the state's so-called endgame legislation. We all know how that law came about, so I'm not going to rehash that today, but I remain grateful to Governor Cox for negotiating a later date of implementation than the legislature had wanted. Additional lives were saved with each day of his extension he negotiated, and I thank you, Governor Cox. The decision by the state legislature to prematurely and arbitrarily end mask requirements in the state of emergency for Utah really revokes the life-saving mask requirement, and it's defied the expertise of doctors around the world, across this country, and right here in Utah, who continue to ask us to wear masks and take other protective measures against this contagious virus. A stand-down date, as they set, without considering new cases, infection rates, or other real-time factors, was not a choice based on science or public health interests. And it had no footing in the medical reality that is being experienced right here in our capital city. Even though we've been encouraged by declining case rates and increasing vaccinations, the decline in Salt Lake City's 14-day and 3-day case averages has plateaued. By the state's own standards, every part of Salt Lake City is still in the high rate of case incidence or very high rate. The state has also only reached 56% of its goal for allocating prime doses of the vaccine so far. And here in Salt Lake City, only a quarter of the residents in Glendale and Rose Park have received at least one dose of the vaccine, compared to about 50% in the avenues in the East Bench. That data, coupled with warnings from epidemiologists about the rapid spread of the highly contagious COVID variants, is enough to tell me that we need to keep doing what has worked, wearing masks. My job is to try to protect the people who live in this city, to try to protect the people who work in this city, and to protect the businesses that employ people here. And that's why today, with the backing of the Salt Lake City Council and the support of medical and business leadership, I'm using the emergency powers given to the Office of Mayor to require that masks continue to be worn in all public settings in Salt Lake City. The state's life-saving mask requirement might end on April 10th, but nothing will change that day here in Salt Lake City. Today's order is issued under the authorities in my first emergency proclamation, which was issued in March of last year. And as mayor, I continue to have the ability to exercise certain emergency powers related to the protection of life and property, and a citywide mask requirement fits into that criteria. This proclamation does not conflict with the state's so-called COVID endgame bill. That legislation defines a specific process for a county health department to enact mask requirements, but it doesn't say anything to preclude a city executive exercising her emergency powers. County Mayor Jenny Wilson's mask requirements saved lives. It helped businesses reopen safely. It protected workers, and it gave consumers the confidence they needed to re-enter shops and restaurants. Governor Herbert's statewide mask requirements saved lives as well, and it created a consistent set of standards county to county, and I am grateful to both for their leadership. From the first case of COVID that made its way into our state, I've been committed to one overarching principle, that as a city, we will be guided by public health data, and that protecting the health of our residents will always be my highest priority. That North Star has meant making some difficult and sometimes unpopular decisions based on the advice from public health experts, from enacting a stay-at-home order to requesting our city stay in a more restrictive guideline phase, to calling for life-saving mask requirements statewide. Every step I've taken as mayor has been in an effort to keep Salt Lake City's residents and workers safe and healthy. I'm proud that we've stepped up when we did, and today we're stepping up again, and we're making another clear choice for the same exact reasons. I can't wait until the day comes when the data allows me to write an order rescinding the life-saving mask requirement, but today is not that day, and April 10th is not that day either. I will be happy to take questions at the end, but next you'll hear from Salt Lake City Council Chair Amy Fowler, followed by Dr. Russell Vinnick, who's the Chief Medical Operations Officer at the University of Utah, Matt Caputo, President of Caputo's Market and Deli, and Dee Brewer, Executive Director of the Downtown Alliance.
Good morning. On behalf of the City Council, as Salt Lake City Council Chair, I want to first thank the Mayor. Mayor Mendenhall, thank you for taking this step, this very important and urgent step to ensure the health and safety of our residents and the people who come to visit, work, and play within our city. I know that masks can be difficult. I know that they're annoying sometimes and inconvenient. But we also know that masks and social distancing are key to continuing to see a decline in this virus that has so deeply affected each and every one of us. For over a year, we have been living in a state of emergency under this pandemic. But finally, there seems to be a light at the end of the tunnel. I urge each of you to be patient with us as we all get through that tunnel so we can see that light. I personally love my new mask, the Salt Lake City flag. It's a symbol of the strength, the community, and the love that this city has. And again, I want to thank you, Mayor. The Salt Lake City Council supports you and this effort.
Good morning. I'm Russell Vinnick. I'm the Chief Medical Operations Officer for University of Utah Healthcare, and I also want to thank the Mayor and the City Council and really all of our elected officials, because these are difficult decisions. In healthcare, our job is to give the facts and the data and give recommendations, but we also recognize that this is a balance, and this is why we've elected our leaders to help us with this. So let me just take you through a little bit of the data and a few important points that we need to think about for now and going forward. So first of all, masks work. If anybody has any questions about the efficacy of masks in spreading disease, think about what's happened with influenza and RSV this year. On an average year, the past 2 years in Utah, there have been about 1,500 influenza-related hospitalizations per year. This year, there have been 14. RSV, as reported by Fox 13 News, RSV at Primary Children's, they've been admitting about 80 patients per week to their hospital with RSV-related illness. Thus far, they've had no cases. We know masks work. We also know that the real efficacy of masks is a little bit to the person that's wearing the mask, but they are much more protective at preventing transmission. So for us to get the most benefit out of a mask, it's not just a personal decision for you to wear a mask, but it is also incumbent on the people around you who care for you and care for the community to also wear a mask to prevent that. Second, as Mayor said, cases are or have been declining in Utah, but they have plateaued. That decline, it does not seem to be continuing, and both in Salt Lake County as well as statewide. And in part, this is related to the emergence of new variants. According to some of our internal data and projections, about a month ago in early February, the UK variant encompassed about 1% of positive COVID-19 tests. By the end of March, that number was close to 30%. That is a very rapid rise, and we expect that to continue to rise and likely will create an increase in cases in the near future. Third point is the quickest path to ending COVID-19 restrictions is through vaccinations and herd immunity. That time could come pretty soon. The likelihood is early summer, potentially late summer, we could achieve that threshold between vaccinations and also people who've been exposed. But if you look at some of the national modeling studies, a lot of lives are likely to be lost, and that number can vary between 80,000 lives lost nationally and 500,000 lives lost nationally. And a lot of that depends on maintaining these public health measures. If those are continued, we are much more likely to be on the lower end of that spectrum. And lastly, I would just say that Utah is a big state, and Salt Lake County and Salt Lake City are very different from the rest of Utah. We have a much higher population density. We also have a higher prevalence in the ethnically underserved communities. We know that as a risk factor for higher cases and complication rates, and so it just makes sense. Please, please, everybody, continue to wear your mask, not necessarily for yourself, or if not for yourself, for all of those that are around you. Thank you.
It's a real honor for me to be here. It's a bit surprising. I mean, all these professionals, I slice salami for a living, so I can't believe people are interested in what I have to say, but I will say that I'm here today to speak on behalf of essential workers, specifically in the food and retail industry. As a food service professional, part of your job is dealing with problem customers and difficult situations. Luckily, these are things that you kind of only have to deal with once every blue moon. But before the statewide mask mandate went into place, our managers, our shift leads, our rank and file were having to deal with very angry people 8, 9, 10 times a day. It wasn't sustainable. People were burning out. They were quitting. They were leaving the industry. Professionals that had been in it for years were leaving what they loved to do. For the essential workers dealing with that, it truly became one of the hardest parts of the pandemic to deal with. When the statewide mask mandate went into place, it was like someone shut off a light switch. It wasn't completely over, but it got so much easier to deal with. Now, most essential workers live paycheck to paycheck. They don't have a choice whether to come to work or not. They don't have a choice whether to be in constant contact with hundreds of people every single day. Many of them have underlying conditions themselves. Many of them are caregivers for people with underlying conditions. They are there working, but many of them are scared. I've heard that, you can, as a business, you can leave your mask policy in place. When I hear that, it shows that they're not listening to what we're saying. The state mandate made it easy for me to say something like, "I'm so sorry, sir. We know where you're coming from. We're just a small business trying to adhere to state law." Now, I'd like to see the public officials that think that we should just rely on policy try to explain this policy to an angry, oftentimes very large man, 8 to 9 times a day, who think that we're threatening their freedom with our policy. It's leaving us on our own. I want to see masks gone too. But we need to wait until all essential workers that want a vaccine have had a chance to be fully vaccinated and have that immunity kick in. The same week that vaccines became available to everyone, we sent an admin professional from our offices to each of our locations with a computer and made everyone that wanted a vaccine get in line and get signed up that very day. Well, we've been tracking each person. The last person that works for Caputo's, even though we tried so hard, the last person is going to get their first vaccine on May 1st. That means the second vaccine, maybe almost a month later, a couple weeks later. We're looking at June at least, and we tried that very day for all of our people. There's a lot to celebrate, guys. I don't want to come off as this angry, governor. I think the governor's done a good job. I think the city and the state, they've done a good job. Utah's doing well. We just need more time. And no matter what you believe about masks and COVID, I think, people have heard the facts. They're either impressed by them or they're not. But the fears are real. Please be considerate to those that are experiencing the fear and don't have another choice, and wear a mask. And Mayor, I didn't know what you were going to do today. thank you so much. Thank you so much on behalf of essential workers. Seriously. Bold. Thank you. Thanks, everyone.
Good morning. I'm Dee Brewer, the Executive Director of the Downtown Alliance. Matt Caputo comes with integrity, with experience about what it means on the front lines. He's your soundbite today. I hope I can provide a little bit of additional color. I join you on behalf of downtown shops, restaurants, bars, hotels, entertainment venues who have been particularly hard hit by the pandemic. Frontline workers stepped up early in the pandemic to ensure goods and services were available to Salt Lake City residents. They innovated. They bore risk of infection before we knew much about this novel virus. We owe frontline workers the courtesy of a few more weeks of mask use until they can achieve the protection of vaccination. Mayor Mendenhall, we support extending the reasonable precaution of using a mask in public and inside businesses until frontline workers have had time to achieve the full protection of vaccination. We are hopeful that we can all achieve immunity soon. We appreciate Salt Lake County's efforts to date to protect residents during the pandemic. We respect the health guidance provided by the Utah Department of Health and the COVID-19 Task Force. We are grateful for the speed with which vaccinated immunity is coming into our communities. The Utah Department of Health has declared that the pandemic is not over and that we must remain vigilant. Putting frontline workers at unnecessary risk also puts Salt Lake City residents and customers at risk. Frontline workers are in direct contact with tens of thousands of residents every day as they bag groceries, wait on tables, take tickets, and welcome hotel guests. Frontline workers are a perfect vector for a virus aggressively seeking hosts in which to propagate. While businesses can require customers to use masks, local government support for extending these health precautions will elevate compliance and reduce the resources necessary to enforce mask use. Some large retailers tell us that they will have to hire additional staff and security for mask enforcement if our local government does not stand with them. Small businesses simply do not have the resources or the scale for hiring enforcement staff. Stay safe to stay open has been our mantra for the last year, and it is still true. Please support our workers and our businesses with continued mask use until workers have the protection of vaccination. The mayor asked me to acknowledge that we have bakeries and coffee shops and roofing companies and sushi restaurants and Red Iguana. I'm looking for other faces behind those masks that I recognize, and florists as well. This really matters for all of these businesses. Matt was articulate about this. They do not have the time and the resources to enforce this at the point of sale. This is for them and for their frontline workers and ultimately the customers who shop there. Thank you.
We're happy to take questions, and as Dee said, you have a great sampling of our local industries here. On my left-hand side, too many to name and call out at the time, but a lot of people able to answer questions for you.
Mayor, a couple of questions. One, point of clarification. Your order extends to all private businesses, is that correct?
It continues exactly what is in place today. It doesn't make any changes to the mask mandate as we've been living it for months now.
I've read HB 294. It doesn't seem to give you any authority to do this. On what basis do you make this decision?
Right, as our city attorneys carefully reviewed that endgame law, and as well as the city's own provisions regarding emergency powers, which I talked about a moment ago, and there, as you said, is nothing in that legislation that prohibits cities either. It says nothing of cities' emergency authorities, and any mayor who's put an emergency proclamation in place related to the pandemic has these same authorities that we find.
But it seems to give the authority to the health department and the county governing body, not the city.
It doesn't remove any emergency authorities from cities.
All right, and then in terms of, if this is not the right time, when is?
Yeah, surely we need to be looking at our vaccination levels, at the pace of new vaccines, at the case count rates, and I imagine that we'll also continue to look at the infection rates and the distribution of vaccines throughout Salt Lake County and our neighboring communities as well, but we're going to continue to make data-based decisions based on what's happening here in Salt Lake City. And it goes without saying, but I'll reiterate that our West Side communities have been the hardest hit since the beginning of the pandemic, and now we're only seeing a quarter of that population having been able to receive a first dose of the vaccine, whereas half of our population in the avenues and the East Bench areas have received that. We need to get further down this vaccination path, and the state's thresholds for their endgame legislation still hold. So they're only at about 56% of achieving that first dose, or rather the prime dose allocations for the state. They've got a long ways to go, and we'll continue to measure that just as the state is.
And your metric would be what?
Just as I said, we're watching what our vaccination rates are here in Salt Lake City, especially in our hardest hit communities, but have hope that those vaccinations will come to a satisfactory place. At the same time, hopefully mid-May, late May is when they predict that the prime dose vaccines will reach that 100% or 1.6333 million vaccines locally. Yeah.
The fact that the county health department has said that they're not going to ask for an extension of the mask mandate, there will be people who interpret that as saying, see, the science shows it's not necessary. How would you address those people?
And you can look at the science of Salt Lake County's data, which is across many, many different cities. When you look at Salt Lake City's data that comes from the county, it's not the same. And as I said, with our 3-day and 14-day averages, we are not continuing to decline the way that Salt Lake County is. We've reached a plateau, and it's actually not a declining plateau. So we're going to continue to work with our local data through our county health officials. And I encourage every city to do so. I know that they all have that same access to their data. Yes.
So, question for you real quick. When you kind of were addressing the crowd here, just didn't seem so happy about this endgame bill. How long have you been planning to extend the mask mandate in Salt Lake City?
Since the endgame bill, we've been talking about looking at the data leading up to April 10th, which is exactly what we've based this decision on. So that it hasn't been a sudden decision. It's really been about evaluating the data and then looking at what the arbitrary date is that the legislature set, and they simply don't line up. Jed?
So let's review. So masks required in all public settings. This is a public setting. Is walking across Sugar House Park a public setting? Is walking down the street a public setting? Or where are we supposed to be wearing masks?
So nothing changes, as I said. It's the same mandate that's been in place from the state and will be until Saturday, and nothing changes from that. If you're going into a business, you're going in to pick up your dry cleaning or go to a restaurant or get your kid from preschool, you need to be wearing a mask, and those places of business can enforce that if they desire based on this mandate, as they could based on the state's mandate. We encourage people in park settings or walking down the sidewalk to wear a mask if you're going to come into contact, especially in close proximity to other members of the public. Please wear a mask. And as we've always done, we're not doing this mandate so that we can legally enforce. That's not a desire that we have as a city. It's an option that's on the table, as the emergency powers would make or authorize for any city who exercises this kind of a mandate. But it's not something that we want to do, and it's not something we've ever done as a city in terms of legal enforcement.
Can any place that's open to the public then deny this emergency power and say you don't need a mask to come in?
No, this is law. Anything else? And I hope you'll have some interviews with these great folks who are standing here beside me. Thanks for coming out today.
Mayor, thank you.